Good morning everyone. I am Rajni Yadav, Assistant Professor at Faculty of Pharmacy, Kalinga University. Today we will be discussing the topic pharmacology of drugs acting on peripheral nervous system. So, nervous system, it is a control and coordination center of our body. Our nervous system is divided into peripheral nervous system and central nervous system. Peripheral nervous system is further subdivided into efferent division, which controls the motor activity in our body, and second one is the afferent divisions, which control the sensory functions in our body. The efferent division is further subdivided into autonomic nervous system and somatic nervous system. Autonomic nervous system are those movements in our body which are not under our control, which is also called as involuntary movements, and somatic system is those which are under our control, means the voluntary movements. The autonomic nervous system is further subdivided into enteric system. It is confined to the intestine, parasympathetic divisions and sympathetic divisions. Now, the parasympathetic divisions basically functions when we are sleeping. The sympathetic divisions works when we are active. So, the peripheral nervous system, the main neurotransmitter is acetylcholine. Acetylcholine is a chemical molecule which is made from two moieties. One is acetyl coenzyme A and the choline amino acid. They both are joined in the presence of acetyl coenzyme A transferase enzyme, and they are synthesized in our body. Now, this acetylcholine is released from the nerve terminals. We have presynaptic nerve terminals, postsynaptic nerve terminals, and this process we call it as a neurohumoral transmission. In the neurohumoral transmission, the impulse conduction for the release of the neurotransmitter is released, and once it is released, the stored neurotransmitters in the synaptic vesicles, they get bursted in the presence of calcium, and once it gets bursted, it is released from the presynaptic nerve terminals and it is released in the synapse. Once it is released in the synapse, the post synaptic nerve terminals, they contains the receptors for these molecules, and they are binded with those receptors. Every neurotransmitter is having a specific receptor for their binding. Like acetylcholine is having two receptors to bind with them. They are falls into the two categories. One is the nicotinic receptors and another one is the muscarinic receptors. The nicotinic receptors are further subdivided into two types: the NM type, which are present in the neuromuscular junctions, and the NN type, which is present in the autonomic ganglia. The muscarinic receptors are further subdivided into 5 categories: M1, M2, M3, M4 and M5, but only M1, M2 and M3, they are playing the principal actions in the body. Now, the drugs which are producing the similar effects as that of acetylcholine in our body, such molecules we call it as a cholinergic agonist or cholinergic drugs. Now, the classification of cholinergic agonist could be divided into two categories. So, one is the choline esters, which includes the acetylcholine itself, then methacholine, carbachol and methanicol. The alkaloids, they include the muscarine, pilocarpine and ericoline. Now, these cholinergic agonists, they exactly mimic the same action as that of acetylcholine in the NN junctions and when binding to the muscarinic receptors also. Now, anticholinesterase drugs are those drugs which increases the concentration of acetylcholine inside the synapse and causes the prevents the degradation of acetylcholine molecules. Now, acetylcholinesterase is the enzyme which is responsible for the degradation of acetylcholine molecules in the synapse, and due to overactivity of these enzymes, the acetylcholine molecule, it divides into two and it is not capable to produce their actions. So, when we give these categories of drug, the anticholinesterases, so they basically prevents the degradation of acetylcholine. Now, it is divided into two categories. One is the reversible category and another one is the irreversible category. The reversible includes physostigmine, neostigmine, edrophonium, rivastigmine, donepezil. Irreversible includes ecothiophed, malathion, and the carbamates. The two categories are given on the basis of their binding. When the binding is reversible in nature, such type of binding happens with the weak forces of attraction like hydrogen bond, electrovalent bonds, electrostatic forces of attraction, van der Waals forces of attraction, and they could be reversed when the drug is eliminated from the body. The irreversible binding are happening by the help of the stable bonds like the covalent bonds, the coordinate bonds, and they do not get easily reversed once it is binded with the drugs. So all these categories of drugs, they increases the acetylcholine concentration in the synapse. Now, the skeletal muscle relaxants are those categories of drugs that act peripherally at the neuromuscular junctions, basically at the NM receptors, the muscle fibers, and they are also responsible to reduce the muscular tones or the paralysis condition. So, whenever there is a condition of excessive twitching of the muscles, the paralysis condition, generally the skeletal muscle relaxants are given. So, these relaxants, they block the receptors, basically the NM receptors, and they produce the relaxant effect. If we talk about the classification of skeletal muscle relaxants, they are also called as neuromuscular blockers because these agents, they block the neuromuscular junctions at the NM sites, and basically they produce the relaxant effects. So it could be divided into non-depolarizing agents, which includes the longer acting drugs like D-tubocurarine, pancuronium, doxacurium. Then the intermediate acting, which includes etracurium, vecuronium, and the shorter acting, which includes the mivacurium. The another category is depolarizing blockers. So it includes the drugs like succinylcholine and decamethonium. Local anesthetics are those agents which produce the reversible block of nerve conduction without doing any structural damage to the neuron, and it is concerned without any loss of consciousness. The local anesthetic, these drugs act locally and confined to a specific areas only. They bind to the local anesthetic receptors which are present inside the cell membrane, and they produce the reversible blockade of the consciousness and are helpful in minor surgeries. If the classification of local anesthetic includes the ester type, which includes the drug cocaine, tetracaine, procaine, benzocaine. Second category is the amide type, which includes the drug lidocaine, bupivacaine, mepivacaine, and dibucaine. So once these drugs are given inside the body, they are binding to the local anesthetic receptors, and these receptors, once activated, they prevent the blockage, or they close the sodium gates present in the cell membranes, and once these gates are closed, the pain receptors at that particular area, they are blocked for a certain period of time, and in this way the local anesthetics are used, and they are used in the minor operative cases. Thank you.